Hello, my friends. Let's discuss acute appendicitis. I am Samih Mikhail. I'm a pathology resident, and this is the Pathway channel. Please like and subscribe to receive more videos. Appendix is a normal true diverticulum and is prone to acute and chronic inflammation. The pathogenesis is mostly luminal obstruction in 50 to 80% of cases, and this may be due to fecolith, tumors, worms, pre-appendiceal lymphoid hyperplasia. Stasis of the luminal content allows bacteria to proliferate that leads to ischemia and inflammation. Your differential diagnosis will be salpingitis, ectopic pregnancy, mesenteric lymphadenitis, and Michel's diverticulum. What about the morphology? For diagnosis, you will find perivascular neutrophilic infiltrate within all layers of the wall, and we will see this in the coming slide. Number two, to diagnose, you need to find neutrophils infiltrate of the muscularis propria. In severe cases, neutrophilic exudate generates a serosal fibrinopurulent reaction, and abscess formation may happen within the wall. This is called acute suppurative appendicitis. In more and more advanced cases, appendiceal vessels may be compromised, so ischemia, hemorrhagic ulceration, and gangrenous necrosis may happen. This we call acute gangrenous appendicitis. Do not forget, when you receive an appendix, look for, yes, acute appendicitis, but this may be caused by parasitic infestation, so search for any parasite in the appendix lumen. Number two, don't forget tumors at the distal tip of the appendix, like neuroendocrine tumors. Number three, low-grade mucinous tumors. You will find pools of extracellular mucin, minimally atypical cells, and hypermucinous cytoplasm. And you may find carcinoma. This will be, you will find nuclear pseudostratification, marked cytologic atypia, and mitosis. Thank you so much. In the coming slide, I will describe the diagnosis of appendicitis. I will mainly focus on the neutrophilic infiltration within the whole wall and in the muscularis propria. Please like and subscribe to receive more videos.
This is Samih again, and this slide is for acute appendicitis, and we are at 2.5 power. And at first I would like to take a look at the slide from low power, and then I will go at high power. From the low power, it's good to appreciate the architecture, whether it's preserved or not. But as we are speaking today about acute appendicitis, so the architecture is usually preserved, and I hope you can appreciate here the four layers of the appendix, which are: first, you have the mucosa, which is composed of the epithelial lining, and then the lamina propria and the muscularis mucosa, and then you have the submucosal layer, then you have the muscularis propria, and at the end, the serosa. To diagnose acute appendicitis, and as per the slides, you need to find neutrophilic infiltrates in the muscularis propria, which will be here. And if you found these neutrophils, then we can say that this is acute appendicitis. We will see this at high power, but before going to high power, this is the muscularis propria we will search for, and this is the serosa, and it seems like the serosa is infiltrated also with inflammatory cells. And this is the lumen, and it seems that it has also neutrophils and inflammatory cells. So from the low power, we can say that this is acute appendicitis. So let's go take a look here. So this is the lumen, and it's filled with neutrophils. And actually, I grossed this specimen, and it was full of pus in the lumen. This is all the wall of the appendix. And here you can see also inflammatory cells at the serosal level. Let's go and see at high power. So here again, this is a 5x lens, and we can see the layers here more clear than the 2.5. So this is again the mucosal layer, the submucosa, and this is the muscularis propria. And I think the inflammatory cells are more clear at this power. And this is the serosa again with inflammatory cells. Let's go at a higher power and continue at 10x, and I will go through the layers again. So this is the mucosa, this is the muscularis mucosa, and here it's more clear that it's all infiltrated by inflammatory cells. Here we have the submucosa, it's all filled with inflammatory cells, and I will go deeper. So this is the muscularis propria. This is the one we will go at high power to confirm the presence of neutrophils, and at this stage it will be acute appendicitis. And this is the serosal layer. Let's go at 20x. So this is the muscularis propria, and as we can see, we have some or many actually neutrophils present. These are all neutrophils. These are all neutrophils. So this is kind of acute inflammation. This is another neutrophil, and I think you can appreciate more and more neutrophils present in the muscularis propria. And this is diagnostic for acute appendicitis. Let's go into the lamina propria and submucosa, and here again you will see neutrophils present. So this is acute appendicitis. But the most important is the muscularis propria. Here I'm going to the lumen. And again, here in the lumen, I hope you can see this clearly. Try to adjust the focus. Yeah, these are all neutrophils in the lumen. So this is how we diagnose the acute appendicitis. Last view will be at the 40x to see the neutrophils. Now we are at the 40x. This is the lumen. This is for sure neutrophils and having like some other inflammatory cells. And as you can go through the wall of the appendix, you will see and appreciate more neutrophils. But let's go to the muscularis propria and confirm our diagnosis. So as you can see here, we have again many neutrophils. It's not hard to define them.